So you can say that there are benefits to having registry data for an individual surgeon made available to that surgeon.
I think that hasn't been achieved yet, but it's a tremendous potential of the registries, right? A lot of effort and investment has gone into the dashboards to make them more user friendly for surgeons, and to be able to, surgeons can at this point access their own dashboards. They don't do it very often. Look at their performance where someone else isn't feeding it to them or, using it to be critical to make decisions about what works best in their hands. There's a lot of scenarios where there are procedures that can give equivalent results, but what's best depends upon what you do best, right? And so for physicians to be able to look at their own dashboards and look at how they perform with a given procedure at that level of granularity is a tremendous potential tool for quality improvement on the individual physician level that is something they can seek out and look at independently rather than be presented to them from outside sources, insurers, things along those lines.
Some registry data is made available for research from the Academy through the Registry Analytics Institute. Are there any other ways that registry information can be made available for outside research or academic research?
Sure. So industry sponsors the registry. They are really responsible, especially at the beginning, with being able to get this effort off the ground. Without industry, we would have no registry. So we're moving towards a world where most of our revenue is coming from licensing fees, and everybody agrees that's healthy. But as part of your sponsorship for industry, you get a certain number of analytic hours from our analysts, and you can choose to do whatever you want with them. So we have very strict guidelines in terms of how that information can be disseminated by industry on their own. If it's for regulatory purposes and it's going to go to the regulator, then we don't need to take a look at it. But if it's going to be for marketing purposes, we need to see it, and you have to be able to show that you've disseminated the complete report, not just parts of it. And the guidelines we have are in line with the other major international registries. So that's the other major source by which information can get out, other than our annual report and our annual report supplement.
I think also from a research standpoint, I think in fact the registry data has been underutilized. And I think it's something that we all want to work on. It's a balance because the data, particularly the data tied to CMS, has been held in a regulatory way where it can't be disseminated even to sort of outside institutions except under very limited conditions. But that looks like it's going to change. It looks like agreement with CMS is going to allow this to be disseminated to more university centers, which would allow a greater amount of data analysis to be carried out, which will hopefully facilitate AAOS members and registry members starting to do research on a more physician-led level as well as the industry applications. I think that's something that we all see as a goal, and it sounds like it would be easy to do, but it turns out to be hard to guard the data, make sure it's being used fairly and honestly, and yet make it more widely available.